Welcome to the Woman's Connection. I'm Barrie-Louise Switzen, your moderator. The Woman's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned? Welcome. It's always a pleasure to have Dr. Carolyn Dean with us. Homeopathic doctor, researcher, inventor, whatever you want to call it. It's amazing what this woman can do. And we're going to talk about our health. And I would like to welcome back Dr. Carolyn Dean. Thanks, Carolyn, for joining me again.
Thank you, Barrie. It's a pleasure to be here.
When you've written a few books. Let's just talk with IBS for Dummies, one of your crazy ones. I can't believe this title.
I know. When my agent asked me to write IBS for Dummies, I thought, oh, that's so politically incorrect. So I called up my sister because I wanted her to help with the research. And she said, oh, get over yourself. I mean, it will reach so many more people than a general health book, because the Dummy series is all over the world, and it's true. It's gone everywhere.
IBS stands for Irritable Bowel Syndrome, in case nobody realizes it. And it's amazing how it can just creep up on you at some of the most inopportune times.
Yes, yes.
What causes it, and how do you prevent it?
Irritable bowel syndrome is a name that's just come about in the last decade. When people had bowel symptoms before of gas and bloating and a change in bowel habits and alternating diarrhea and constipation, it was called spastic bowel or mucus colitis.
Very appetizing.
Yes, very. Or it was just called a psychological stress problem. And in the past decade, it's been given a name, but I contend that it is mostly related to the type of diet that we've been eating in the past number of decades. And I'll tell you why. We've been eating more processed foods, more junk food. We've been eating wheat that's very processed, a lot of white flour products. We've been eating dairy where the cows have been treated with antibiotics and hormones. We've been eating so much sugar that I think it's up to 150 pounds a year per person. So all these sort of inedible, irritating foods that are going into our bodies, there's a certain percentage of people that just can't handle it. And the percentage is up to about 20% of the population. So you'll eat these foods on a daily basis and have grumbly intestines and take antacids and take all kinds of medications to try to suppress these symptoms, take Metamucil if you have constipation, but really you're just treating a bad diet. And when you go to the doctor and you complain about gas and bloating, and seriously, you can gain about 4 dress sizes with the bloat that you can get with IBS. So when you go to your doctor, the doctor, well, half of them think it's psychological, and the other half who've read the medical literature that's now saying, yes, IBS does exist, they don't know what to do. They really don't. They'll give you symptoms to slow down your bowel or speed it up. And one of the major medications that was on the market, Zelnorm, when I did an analysis of the studies that had been done, it helps 8% of the people.
That's pretty good.
8% of
20%
of 100 people, maybe 8 people will get some benefit from this drug.
I guess it's not very good.
No. And when you look at the side effects, it can kill you.
Oh, that's really not good.
Okay, so it's just hardly worth it. And the warnings are all over the label, and they still sell it. And there are actresses on TV that promote it. So there's not much to do for people with IBS medically. There are no drugs. So when I wrote this book with my sister, I began looking at the causes, and one of the major causes seems to be taking antibiotics that change the intestinal flora and cause yeast overgrowth. And I've written a book on yeast too, so
quite interrelated.
Very much interrelated. And what we find is if you put people on a yeast-free diet, which starts out with avoiding sugar, avoiding wheat, and avoiding dairy, you can cut the incidence of IBS maybe about 70%. In other words, 70 out of 100 people
Wow.
will get symptomatic relief just by changing diet.
Well, let me ask you something, because I know somebody who had it, and they would always take acidophilus,
Acidophilus, yes.
and that would help them.
Right, right.
And that you find in yogurt.
Yes. Acidophilus is a good bacteria.
Okay.
When you take antibiotics, you kill off the good and bad bacteria. So by taking acidophilus, you build up the good bacteria again. And yogurt, for most people, yogurt is not really a dairy product because the fermentation of yogurt takes out the lactose. So people who are allergic to lactose or don't digest lactose, they can use dairy products and get the good bacteria. But you have to, I say you have to do an experiment of one. You have to try a food and see if it affects you. But first of all, actually, if someone wants to know if they're sensitive to dairy products, you would avoid all dairy products for 2 weeks and then eat maybe cheese and drink a glass of milk and do that in one day and then wait for 48 hours. If you get symptoms after avoiding it for 2 weeks and then eating a lot of it on day one and waiting 48 hours, then you'll know if your body can tolerate that food.
That's interesting because I cannot really tolerate milk, but I'm doing a lot of yogurt these days.
Mm-hmm. Mm-hmm.
And I have no problems with the yogurt.
Mm-hmm. There you go.
But I don't have irritable bowel syndrome, so but it's helping me in other ways, so
Mm-hmm.
it's really great.
Mm-hmm. Very good.
So I guess people should really try it.
Mm-hmm.
Women are susceptible to yeast.
Yes.
Do women realize what yeast is, or do they just know that they're not feeling well and don't know what's going on?
Yes, the book I've written on that is called The Yeast Connection in Women's Health. And yeast can start when you're very young. You can develop yeast when you're in the birth canal.
Really?
If your mother has yeast overgrowth in the intestines, which gets into the
Placenta?
private parts,
Oh.
and in the private parts there's yeast, and the baby comes through the private parts and picks up yeast, then the baby can have what we know is thrush. That white coating on the tongue is thrush. That's candida yeast.
Holy cow.
And they say babies grow out of it or whatever. But what I tell moms, I do a telephone consulting practice, so I'm always talking to people about yeast and what to do for it. A mom can take the acidophilus, it's also called a probiotic, and build up the good bacteria. She can get baby acidophilus and give it to infants. There are forms of it that are safe to use for infants. And by giving the infant the good bacteria, it pushes out the yeast. So you can be born with yeast, and then say you get ear infections or throat infections when you're young, and you're given antibiotics. The antibiotics can kill off the good and bad bacteria in the intestines, and the yeast overgrows. If your mom doesn't know about acidophilus and doesn't give you yogurt or acidophilus powder or acidophilus pills, then your yeast will overgrow. And at that point, an overgrowing yeast produces toxins, and the toxins, they number in the hundreds. I think there's 180 different toxins that yeast produces.
In your body?
In your body. When they go through their life cycle, they discharge their waste products. And some of them are alcohols and acetaldehydes. We have case histories of people who measure blood alcohol levels as if they were drinking, and they haven't been drinking any alcohol, but they've just been creating their own still in their bodies with this yeast overgrowth.
That's amazing.
Yeah, they get pulled over for drunk driving. They have brain fog and confusion. So this is what's happening to some people who have yeast overgrowth. It grows in the intestines, and then the toxins are absorbed through the body, causing mood and memory problems, poor concentration, causing skin conditions. Acne can be yeast. Psoriasis can be yeast. So these toxins can cause symptoms from head to toe. If you go to your doctor and say, I've got intestinal yeast and I have all these symptoms, they won't really believe you, because in medical school we were taught that yeast is just a pesky women's disease in the private parts, or it can be a very serious illness with bloodstream yeast infection, and that person is likely dying in the hospital because of a yeast overgrowth. So the doctors don't understand that sort of intermediary stage where you've got very bad intestinal overgrowth. And just like with the IBS I mentioned, you can grow about 4 sizes in your skirt and dress size just from the bloating from yeast.
Wow. What does it mean that you have a leaky gut? I mean, is this all interrelated or what?
It is interrelated. A leaky gut is where the yeast in the intestines can actually poke holes in the intestinal mucous membrane. Those are microscopic holes. Medicine knows about it. Scientifically, they've shown that a leaky gut can absorb incompletely digested food molecules, and those can become allergenic in the bloodstream because they're molecules that shouldn't be in the blood, and the immune system attacks them. And then you think you're allergic to a food, but really you're not chewing properly, for one thing. And then it's getting to this leaky gut where not only are yeast toxins absorbed, but incompletely digested food molecules.
Now, what about the large intestine? Is that interplay with everything else here, or what?
Yes, in the large intestine is where the yeast normally reside. But when they overgrow, when the antibiotics kill off the good and bad bacteria and leaving lots of space for the yeast, they just take over. And then they grow up into the small intestine. And in the large intestine, that's where water is absorbed from the large intestine so that our bowel movements will be of a solid consistency. Well, that absorption of water can also pull toxins into the bloodstream as well. And the yeast toxins that we already mentioned will be absorbed into the bloodstream and then cause reactions in the body. We have cross reactions of yeast chemicals with the thyroid tissue, with the ovarian tissue. We have such a level of toxicity from yeast alone that some of us feel that it's the major cause of inflammation in the body. And that inflammation can affect the heart, can affect the joints, be giving people arthritis and just an achiness throughout the whole body.
So how do you test for a yeast infection with all these toxins and everything else?
Now there's the rub. Since we all have some yeast, if we look for yeast antibodies, then everybody has them.
Okay.
There are some specialty labs that will do yeast antibody tests and do quantitative tests. In other words, if you have very high levels. I did that for many years in my private practice, and I correlated them with questionnaires. I find if I ask people 7 basic questions, I have a fairly reasonable degree of confirmation of their yeast. So the questions are, have you taken antibiotics in the past, and how much have you taken? With women, have you taken the birth control pill? Are you craving carbohydrates? Do you get gas and bloating? Are you worse on damp, moldy days because mold cross-reacts with yeast?
Oh,
and do you have itchy eyes? And the itchy eye thing, I say to people, well, you know, you have so many toxins, you're up to here with toxins, and your eyes start squirting out the toxins. So it's all basic symptoms. There are many more questions that I can ask to be, you know, more confirmatory, but those are the basic questions.
What is the best way to get rid of yeast or yeast infection besides giving up chocolate?
Well, chocolate's fun because it's so high in magnesium. That's why people crave it. But it also has a lot of sugar. So to get rid of yeast, you have to starve it. And the main things that yeast likes to eat is sugar, milk sugar. So you're avoiding sugar and dairy.
Well, wait a minute. So avoiding milk, is yogurt part of that?
No.
Okay, go ahead.
It's mainly the dairy that has lactose.
Okay.
Because that's a milk sugar, and that's what the yeast will eat. And you avoid wheat as well, especially breads with yeast, because the brewers and bakers, the baker's yeast in breads can cross-react with yeast for some people. So we're avoiding sugar, wheat, and dairy. Those are the main things. And alcohol. Sorry, there goes the alcohol. And when you're starving the yeast, you can have a die-off. You can feel a little worse as the billions of yeast are starved. They will release their dying-off products, and you can feel a little worse. We use probiotics, as you mentioned, the acidophilus, to build up the good bacteria. And then there are various antifungals that I tell people to take. It can be garlic, caprylic acid in a safflower oil. I use a caprylic acid oil, bentonite clay to absorb toxins.
What is that? Wait.
It's a clay. It's an edible clay, and it has such a broad surface area that it attracts toxins, the toxins that the yeast produce when they die. The clay absorbs them, and you don't get the die-off effect. And the third product that I use all three together, the caprylic acid oil, the bentonite clay, and psyllium seed powder, which is Metamucil. So the psyllium seed is like a jelly, and it mixes with the clay and the caprylic oil, and it's like a soft sponge that goes through the intestines, pushing up against the intestinal wall and scraping off the yeast and killing them.
How long does the process take?
Oh, it can take a long time.
What's a long time?
Well, it can be like 3 weeks on and 1 week off for 3 or 4 months. And then people really know they're feeling better. I get reports back with my telephone clients. I get them to report back, say, every month. And most people after the first month, they're 50 to 60% better, and they're hooked. They want to feel even better. So they continue the process periodically. For reasonably healthy people, it may be just 1 month every season that you do that type of gentle detox.
So that's basically a good detox to use generically to get rid of all the toxins in your body?
Personally, I think so. I'd have to, correspond with people individually to know what they needed. But I personally use it as an ongoing detox. After all, we live in New York.
Do you find that the situation with the quality of the air and people's stress level here in New York has increased since 9/11?
Very much so. It's just always in the back of our minds, what's going to happen next? When's the other shoe going to drop? And it's difficult to live with that psychologically. So we're on a constant alert where our adrenal glands are always pumping and just ready for the next emergency. And for that, we need magnesium. My book, The Magnesium Miracle, I talk about stress and anxiety and the need to support the adrenal glands with magnesium. So that's important. And then for air quality, every time something kind of blows up in New York, those particles, we breathe in. And they do get into our body, but we have detoxification mechanisms in our body, our liver and our lungs, so we have to exercise them. Our intestines are another area of detoxification, so the the yeast detox I mentioned is very good. Our skins are a very good detoxifier, so we can do saunas. Anytime you exercise and sweat, you're getting rid of toxins. But we have to remember that when you sweat, you lose more than just water, and you lose much more than just salt. I'm doing a lot of research now with minerals and the types of minerals we need to absorb. And I'm looking at angstrom-sized minerals.
So wait, I just want to go back 1 second. You're saying when you sweat, when you're exercising, you're getting rid of more than salt.
Oh, yes. Let me give you an example. We're looking at what's happening to soldiers in Iraq. When they're in 110-degree weather with their 80-pound flak packs and running around, they're losing so much water and so many minerals that when they take off their shirts, they can literally stand them up. There's so many minerals in their sweat. They have to beat off the dust of the minerals. And when they just take their replacement electrolytes, which is salt and sugar, they're not getting their magnesium, their potassium, their chromium, their boron, their molybdenum. They're not getting any of that. So in fact, by taking that much water, they're actually causing cerebral edema without the proper minerals.
So what's the solution to that?
The solution is to get these people the right kind of minerals, the angstrom-sized minerals in sufficient quantity and quality, not just salt, but magnesium, potassium, and calcium. They're all important.
But how do you get past the pharmaceutical industry to give them the necessary minerals and vitamins?
Well, as the research is coming along, wash their shirts and then measure the minerals that you find in that water, and you'll find that they're losing considerable levels of about a dozen different minerals.
Carolyn, what do you think of fasting as a way of getting rid of all the toxins and the yeast and all the unwanted things in your body?
Well, there are many ways to detox. 30 years ago, people were doing a lot of water fasting. We found that wasn't good for the body. It broke down too much tissue. It was too stressful on the liver. So I don't recommend water fasting. I recommend vegetable juice fasting with lots of psyllium seed powder to keep the bowels moving. Some people can do colonics with registered colon therapists, so you know that everything is perfectly sterile, etc. There are many ways of detoxifying. Sometimes I find that sort of is a way that people don't bring into their lives enough. In other words, they'll go to a clinic, they'll go on a cleanse, they'll do the big detox, and then they come home and they can't maintain it. So I would rather people do the gentle detox I mentioned earlier, where you do psyllium seed and bentonite and maybe the caprylic acid oil if you feel you have yeast, and do ongoing detoxification that you can bring into your life. Maybe you can go to a clinic and do a jump start. Actually, that's a good point. I do go to a clinic, the Charlotte Gershon Health and Restoration Center in San Diego, and that's a week-long therapy where we just do juices and do clay packs and do intestinal detox. And
Sounds like a spa.
It is. It's just fabulous. It's for people who want to cleanse and balance out their blood sugar and their cholesterol and their hypertension just by diet alone. And you can learn how to bring that into your lifestyle because it's all about education.
What would you like to leave the audience in the closing moments of the show?
I usually tell people to really look at your health as something that you own and that you're responsible for. Going to doctors has always been about diagnosing disease and giving you a medication. Doctors aren't trained to prevent disease or bring you back to health. You're responsible for that. And I basically tell people to look at food-based vitamins, angstrom-sized minerals, get their exercise, do their detoxification, and people can go to my website and get more information. I'm always available, and as you say, my books are there to help educate people to take care of themselves.
Carolyn, thank you so much. It's been terrific.
Thank you.
And I hope you've learned something. But more important, are you taking charge of your health? Look forward to hearing from you. Dr. Carolyn Dean would love to hear from you and be happy to answer any of your questions. So write us here at the Women's Connection. Look forward to hearing from you. Bye now.